Greetings everybody. Today I'll be sharing with you some of the researches of vitamin K2 on chronic kidney disease and the future prospects. As we know, according to the structure of compound, naturally occurring vitamin K can be categorized into vitamin K1 and K2 respectively. What is more important is not just the difference in structure, but their physiological function. Distributed primarily in the liver, vitamin K1 is involved in the activation of blood coagulation factors, while vitamin K2 is primarily stored outside the liver tissue and is responsible for the activation of proteins such as osteocalcin and matrix GLA protein that are not related to the coagulation factors. Vitamin K1 is found mainly in green leafy vegetables, while the major source of vitamin K2 is fermented food. Vitamin K is commonly known as an important coagulation factor. Blood coagulation factors secreted by the liver are initially in inactivated form. Only through activation by gamma-glutamyl carboxylase will these coagulation factors be activated, and this process requires the action of vitamin K. That is to say, vitamin K plays an important role in the activation of blood coagulation factors.
所以说维生素 K 是一个重要的凝血因子活化的一个因子。那么
Other than coagulation factors, there are also other vitamin K-dependent proteins. And of course, activation by vitamin K is essential for the activities. For example, it is an MGP protein, an important inhibitor of vascular calcification in the human body. In order for it to be activated, it needs to be released from the cell after being carboxylated. Osteocalcin, which is responsible for the promotion of bone formation, similarly needs to be carboxylated for it to be activated.
还有骨钙素也是一样，骨钙素它在我们人体的重要的功能是帮助这个血钙，在这个骨骼的这个沉积啊，它的这个功能发挥呢，也是需要羧基化的一个过程啊。
So how does vitamin K inhibit vascular calcification? Back in 1997, a group of researchers generated a number of knockout mice by removing matrix GLA protein from them. These mice later were found to have developed severe spontaneous vascular calcification. In other words, the loss of functions of matrix GLA protein can result in spontaneous vascular calcification. This thus suggested that these protein has the function of suppressing vascular calcification. This protein is also present in our body, and vitamin K is necessary for its activation. Hence, if we think alternatively, in theory, inadequate intake of vitamin K that results in vitamin K deficiency can lead to calcification of blood vessels.
如果说维生素 K 摄入不足，或者说维生素 K 缺乏，那么就会带来血管钙化，这个是理论上的一个推导。那么
This phenomenon is also commonly seen clinically. For example, patients who are on warfarin for a long period of time are prone to develop osteoporosis and vascular calcification. As a vitamin K antagonist, warfarin acts through blocking the action and thus the cyclic reuse of vitamin K, leading to vitamin K deficiency. The lack of vitamin K then causes coagulation factors to lose their function, thereby inducing its anticoagulation effect. Deficiency of vitamin K also means that the two previously mentioned proteins, MGP and osteocalcin, are deprived of vitamin K and hence cannot be activated, ultimately resulting in osteoporosis and vascular calcification.
那么就会带来这个骨质疏松和血管钙化的这个问题。
As we all know, the main function of blood vessel is to allow blood to circulate to the various organs in the body. So what pathophysiological effect would vascular calcification bring about? In order for the heart to pump and deliver blood to the various tissues and organs in the body, compliance and elasticity of the blood vessels are essential. The fulfillment of these two criteria can enable stable supply of blood to the organs of the body. However, if a blood vessel loses elasticity, a greater pumping force from the heart would be needed. As a response to this change, myocardial tissues will structurally morph and leading to cardiac remodeling. Another point to note is that blood perfusion to our heart relates closely to the opening of coronary artery during diastole. Progression of atherosclerosis of the coronary artery can lead to decreased diastolic function, and hence ischemic heart disease. There is also another reason why inadequate blood perfusion can result in various types of illnesses. It is the importance of elasticity of blood vessels to the cerebrum and kidney. When blood vessel loses elasticity, the impact force on the vascular wall becomes considerably large. This can cause blood vessels to rupture, cerebral hemorrhage, renal hypertension, and generally increased risk due to hypertension. In short, vascular calcification is the basis to many cardiovascular and cerebral diseases.
如果说它失去弹性，那么这个血管壁受到的这个血管冲击力就会很大，冲击力大之后呢，就会带来这个血管破裂、脑出血啊这些临床表现，或者说肾脏这个血流压力更高，就会带来高血压的这个风险。所以说，这个小小的血管钙化，它是很多心脑血管的病生基础。
Today, I would also like to discuss with you a group of populations. There are patients with chronic kidney disease that require dialysis. But why this population, you may ask? The reason being the relatively high risk of vascular calcification in these patients. There is a 50% chance for patients with chronic kidney disease to develop vascular calcification, and that increases to 80% for those receiving dialysis. The occurrence of vascular calcification has little relationship with the concentration of calcium in the blood. In fact, it is found that the number of years the patient was on dialysis and the age of when chronic kidney disease symptoms started to occur are more related. Other than the usual risk factors such as hypertension, dyslipidemia, hyperglycemia, and smoking, there is another independent risk factor unique to this group of patients that will contribute to the vascular calcification. The high rate of vascular calcification in hemodialysis patients has a significant clinical implication. This is a curve showing the relationship between the level of vascular calcification and the survival rate of hemodialysis patients. As we can see, there are clear differences in survival rate between hemodialysis patients with CAC score above or equal to 400, which is shown here in red, those with CAC score below 400 and above 1, and those with a CAC score of 0. While hemodialysis patients with CAC scores no less than 400 have approximately a 5-year survival rate of 30%, the rate is 80% for those with a CAC score of 0. All in all, vascular calcification can seriously impact the survival rate of hemodialysis patients. This supports the fact that vascular calcification is one of the main pathophysiological mechanisms of cardiovascular diseases. Relating to the high rate of vascular calcification in patients with chronic kidney disease, there is a possible unique mechanism to these patients. Recently, hyperphosphatemia is considered an important risk factor for vascular calcification in patients with chronic kidney disease. It is believed that every 1 milligram per deciliter increment in blood phosphate concentration will considerably increase the risk of vascular calcification. Moreover, depending on the area of concern, the risk increases differently. For example, 22% increase for coronary artery and 61% rise at the mitral valve. So, can we inhibit vascular calcification by controlling serum phosphate level? Is it possible to reverse the condition? Here we have a past research that looked into this. When compared to the placebo group, chronic kidney disease patients from either treatment groups, those prescribed with calcium-based or non-calcium-based treatment for hyperphosphatemia, had the CAC score increased. This result was not desirable, as we originally thought vascular calcification can be suppressed via reduction of blood phosphate level. Although the level of phosphates in blood were controlled, the opposite occurred and vascular calcification was exacerbated. Moreover, the same result was found in both coronary artery and abdominal aorta.
现在血磷水平能够控制，但是病人的这个钙化呢，反而不但没有这个得到控制，反而是升高了，从这个冠状动脉和腹主动脉来看呢，都有一致的这个结果。好，那么
Since this hypothesis did not seem to be working, Another important risk factor was drawn into attention instead. It is the control of hyperlipidemia, owing to the fact that hyperlipidemia is an essential risk factor for vascular calcification. In this study, statins were used to control hyperlipidemia. The amount of atheromal plaque that were formed in patients who were not prescribed with statin increased significantly in the study. In addition, as indicated as blue in this picture, calcification was also exacerbated. On the other hand, although plaque formation was suppressed in patients who were prescribed with statins, calcification of vascular smooth muscles was also shown to have risen. In conclusion, the fact that statins might have promoted coronary atheroma calcification cannot be ruled out. It was concluded that calcification cannot be suppressed through controlling of lipid profile using statins.
所以说，在这个文章他们的这个结论里就提到呢，他汀有可能是它会促进这个冠状斑块的这个钙化的啊，所以说通过这个他汀抑制血脂来减少这个钙化，好像这条路也走不通。再来看
Moving on, can suppression of calcification made through the usage of statin in hemodialysis patients? In this study, when compared to the placebo group, a statistically significant higher incidence rate of vascular calcification was found in the group that were given statin. This result prompted the author of this article to ask, should statins be banned from dialysis then? As this result was unexpected, the author further went on to perform some basic researches to understand more about this phenomenon. And it was found that the secretion of vitamin K by vascular smooth muscles reduced when treated with statins. In other words, it was deduced that statin blocked the synthesis of vitamin K in vascular smooth muscle, resulting in an increase in vascular calcification. This further implied that supplementation of vitamin K might have the potential to suppress the progression of vascular calcification. Nevertheless, this proposed mechanism was backed by previous basic research.
通过这个补充维生素 K 维生素 K 来这个抑制带着血管钙化的这个进展因为前面有非常多的这个理论基础来支持维生素 K 它参与了这个抑制血管钙化的这样一个过程。
Next, it is about the large-scale studies of vitamin K supplementation on healthy population. This is a study that was published in Norway. The daily intake of vitamin K1 and K2 in over 2,000 middle-aged Norwegian healthy individuals were analyzed. The results showed that high vitamin K2 intake might be able to reduce cardiovascular risk. However, no relationship between the intake of vitamin K1 and cardiovascular risk was seen. As a conclusion, it was believed that high-level intake of vitamin K2 through diet can reduce cardiovascular risk.
饮食当中摄入这个高水平的维生素 K2是能够减少心血管疾病的。再来看
Then we have this Japanese study. This is a very interesting study. The correlation between natto consumption and hip fracture risk was demonstrated here on the map. The more natto was consumed in that area, the lower the bone fracture risk was. Contrarily, the lower the natto consumption was in the area, the higher the hip fracture risk was. In other words, there is an inverse relationship between the consumption of MK7 and the occurrence of hip fracture risk. It was also found that daily recommended intake of vitamin K1 and MK4 are insufficient in terms of activation of osteocalcin. With that in mind, it is believed that MK7 can activate osteocalcin and thereby reduce the incidence rate of bone fractures. The author concluded that MK7 is more effective in activation of osteocalcin than vitamin K1 and MK4.
他们的这个研究里面，他们也提出了维生素 K1 和 MK4的这个摄入的这个水平并不足以去活化这个骨钙素它是需要这个 MK7 来活化骨钙素，以降低这个骨折的这个发生。 所以说，在作者的结论他就提到，MK7相较于维 K1和 MK4的话，它对骨钙素的羧基化更加有效。再来看韩
Next,
国的研究，
in this study
韩国
conducted
对
in the Netherlands,
200
more
多
than
位这个
200
健
healthy
康的绝经后
postmenopausal
妇
women
女
were given
称为
180 micrograms
MK7
of
180 微
MK7 per
克
day
每
for 3
天随
years.
访3年。通过
The
他们的
results
随访
showed that
结
the
果
level
可
of
以发现，
inactivated
那么
uncarboxylated
MGP 蛋白的这
dephosphorylated
个
form
水
of
平，
NGP
未
was
羧化的
decreased in
MGP
these
蛋白水平
subjects.
是能够下降的，这就
This
反映了
implied
补
that
充维生
vitamin
素
K
K 之后呢，
supplementation
它的
might
维
have the
生素 K
potential
缺
to
乏的
correct
水平
vitamin
是
K
能够得到
deficiency.
纠正的。它的这个
The endpoint of the
主
trial
要
was
的临
vascular
床终点呢，就是
elasticity.
血管的弹性。发现血管
It
弹
is
性呢
believed
是
that a
能够
drop
得
in
到改
carotid
善，它的
thermal pulse
PW
wave
水平是
velocity
能够明
will
显的
result
下
in the
降，
improvement
并
of
且呢，
vascular
对于
stiffness.
那些就是血管
The
激素
improvement
弹
was
性比
more
较差的
significant
这
on
些人
subjects
群，
with poor
它的
value
改
at
善
baseline.
更加的明显，改善更
The
加明
group
显。
with better
对于
value
那
at
些血管
baseline,
弹
in
性
other
基础
words,
比较好
those
的
with
血管
vascular
还是
stiffness
比
maintained
较
at a
有一
certain
定
level,
弹性的人呢，
stiffness
补
was
充
not improved
MK7它的
considerably
这个
upon
改善的
intervention.
水平，不
From the
够
result
不
of
够
this
大。
study,
对
it
于那
can
些
be
基础条
concluded
件
that
比较差的血管
supplementation of vitamin
弹性
K2 on
基础条件比较
postmenopausal
差的，
women
它的
can
改善的这
increase
个
vascular
程度就会更
elasticity.
多啊。所以说，从他们的这个研究的结果来看的话，维生素 K2它是能够改善绝经后妇女的血管弹性的。这又
This
是一个
is a
研
study
究，
that
它是补
investigated the
充
effect of
维生
vitamin
素
K
K
supplementation
来看
on
对
calcification
瓣
of
膜
the
的
aortic
钙化的
valve.
进展是否
The
有这个
calcification
逆转
progression
或
rate
者
of the group
说
which was
延
given
迟。
vitamin
那
K
从他们的研
supplementation
究结果
was
来看的
10%,
话，补充维
as
生素
compared to
K 组的他们
22%
的
of that of the
心脏
control
瓣
group.
膜钙化的进展是
In
10%，
conclusion,
那么
vitamin K
对照组的
supplementation
瓣
can
膜
slow
钙
down the
化的进展
calcification of
是
aortic valve.
22%。从这个研究
The
结
study
果
was
来
well
看，
received
他
and
们
was
得
quoted
出
in
的
an
结
article
论就是
related
说，
to
补
vascular
充维生素
calcification
K
that
是
was
能
published
够
in the
延
New
缓这
England
个
Journal of
心血
Medicine in
管
the
瓣
following
膜
year.
钙化的。那么相应的这个研究的结果也被新英格兰在第2年就是讲这个血管钙化的这个综述里也做了这个引用啊，做了引用。 刚才提
As
到
I
对于
mentioned a while
这
ago,
个
since
慢
the
性肾
incidence
脏病
rate
的病
of
人，他们
vascular
血管钙
calcification
化
is
的
high
发
in
生率就
patients
很
with
高，
chronic
血管
kidney
钙化
disease,
之后对他们的
serious
造
clinical
成临
outcome may
床结
ensue.
局的影响也会非常
Although
的
vitamin
严
K
重。那么是
supplementation
否
can
可以
improve their
通过
vascular
这个补
calcification
充维生
condition,
素 K
a
来
prerequisite
降
of
低他们的
vitamin
血
K
管钙
deficiency
化？
is
那么这
necessary.
里需要有一个前提，这个前提
Actually,
就是
it
他
was
们到底
reported that
缺
a
不
large
缺维生
proportion
素
of the
K？
patients
那么
with
从
chronic
很
kidney
多的
disease
临床
in
研究
most
来
of the
看啊，
studies
临床
were
研究在
severely
大量的
vitamin
临
K
床研究已
deficient
经证
before
实了。
intervention.
慢性肾脏病的病人，他们是缺乏维生素 K 的，并且他们的这个缺乏程度还是比较多的。再来看这是我们的研
Moving
究，
on,
我
this
们
is
的
one of
研
our
究也发
researches.
现这个
We found out that the
慢
level of
性肾脏病
DPUC
维持透析
MGP
的
in
这些
chronic
病
kidney
人，他们
disease
的这
patients
个胃
who
缩
are on
化的
dialysis was
蛋白较
significantly
正
higher
常
than
人
that
是
of a
明
healthy
显的升
individual,
高，说明他的
indicating
这
the
个
high
他们的这个
severity
缺乏
of
也
the
是非
vitamin
常
K
严
deficiency.
重。这是一个。第二个结
A
论呢，
second
就是说
observation is
在
the
这
high
些人
CAC
群当
score
中，
in these
他们的
patients.
这个
The greater the
血
age,
管钙
the
化的
longer the
水
patient
平
was
也
on
是非
dialysis,
常严
the
重，也
higher
是
the
非常严
CAC
重。
score
随着
is.
他们的年龄以及透
A
析
third
的这
point,
个
it is a positive
时间的
correlation
增加
between the level
透
of
析的时间
DPUC
增加，
MGP
那么他
and
们的这
CAC
个就
score.
是钙化的水平也是增加。还有第三个呢，就是说他们胃羧基化的这个 MGP 蛋白水平跟他们的钙化水平也是有呈现性相关性的。也就是说，他们的这个胃羧基化的这 MGP 蛋白水平越高，他们的这个钙化水平也会更高啊。再来看这
Here, a
个
summary of the
其他
researches
的一些
pertaining
研
to the
究，就
use of
是说
vitamin
慢
K
性
on
肾脏
chronic
病
kidney
病人
disease
的维生
patients
素 K 的水
is
平
shown.
与心血管钙化的相关的研
Despite
究
the difference in sample size
从
among these
各个研
trials,
究的他
all of them
们
studied and
的
revealed the
研究
relationship
的这个
between
人的病
DPUC
人的数
MGP,
量不一
a
样，
marker for the
但是
vitamin
呢，
K
他们研
deficiency,
究的对
and
象
vascular
都是这
calcification.
个胃羧基化的 MGP 水
With the
平。
results of
这
these
个 MGP
researches,
水
a
平呢，就
conclusion
反
was
映维生素
arrived.
K 到底缺不缺乏
Patients suffering from chronic
以
kidney
及
disease
他们
in general
他
are
们
deficient of vitamin K, and the DPUC MGP levels are remarkably high. Also, there is also a positive correlation between the DPUC MGP level and the severity of vascular calcification.
这些慢性肾脏病的病人，他们缺乏维生素 K， 他们 MGP 蛋白水平是明显升高的，并且 MGP 蛋白的这个水平跟他们这个钙化的这个程度是有相关性的。还有
Also about chronic kidney disease patients who are on hemodialysis, is it possible to reverse vitamin K deficiency through vitamin K supplementation? From these research examples, although the dose of MK7 used in these studies varies from 45 microgram to over 400 microgram, improvement of vitamin K deficiency as a result of MK7 consumption was seen.
都能观察到这个维生素 K 的缺乏是能够得到纠正的，是能够得到纠正的。
On top of that, vitamin K deficiency was corrected through vitamin K2 supplementation. But whether this improved vascular calcification, many RCT are still underway to verify this. Outcome-wise, some trials use PWV, an indicator of vascular elasticity, while some use CAC score. Unfortunately, depending on the trial, incoherent results ranging from improvement, worsening to no effect were seen. In summary, the supplementary effect of vitamin K on the health state of blood vessel is still unclear.
那么有一些研究发现呢，补充了维生素 K2之后呢，是能够延缓这个血管钙化的这个些指标的这些进一步的恶化的。但是有的结果呢是没有发现的，是没有发现这个他们跟这个补充维生素 K2是有相关性的。所以说从现在目前的这些研究结果呢来看的话，有支持维生素 K 对血管健康是有好处的，也有研究结果呢是没有发现他们的这样的这个相关性的。
Here, a few RCTs that study the effect of vitamin K supplementation on bone health are summarized. In studies where the effect of vitamin K1, MK4, and MK7 on postmenopausal women were investigated, vitamin K is shown to be effective in increasing bone mineral density and reducing fracture risk. On the other hand, there are studies that reported no statistical significance between vitamin K supplementation group and control group. Hence, when evaluating studies related to vitamin K, the type of vitamin K administered must be taken into account. This is because even within vitamin K, there are reports that MK7 is found to be superior to vitamin K1 and MK4. Other than the type of vitamin K, the outcome and the intervention duration must also be considered. Especially for bone-related research, if the intervention period is not long enough, the effect might not be readily observable.
对于这个骨钙素的这个活化，它会更有活，它更强。所以说我们在评价这个补充维生素 K 到底对这个骨骼健康有没有作用的时候，我们一定要分析它是用的哪一种这个维生素 K 的剂型。第二个，它的观察指标到底是什么？第三个，它的观察时间是否是足够的长？因为对于骨骼健康的这个观察的话，它需要时间需要足够的长。
Returning to studies about blood vessels, this is a critical review of the potential cardiovascular benefits of vitamin K that was published May this year. Relating to the clinical effect of vitamin K on cardiovascular health, it was concluded that vitamin K2 is superior to vitamin K1. However, studies with a larger sample size is necessary to further validate such theory. Up until now, although the potential of using vitamin K supplementation to rectify deficiency of vitamin K, suppress vascular calcification, and prevent cardiovascular disease have been shown in many studies, more than half of these studies are on healthy individuals. In relation to patients with chronic kidney disease, there is a need for a larger scale RCT. Personally, I think more time should be used for observation of this type of trial, and the type of vitamin K should also be thought through. Stratified analysis should also be used to obtain more accurate results.
纠正维生素 K 缺乏之后，最终能不能转化为这个血管钙化的纠正，能不能转化为心血管疾病的发生率的降低？这个呢，除了前面的这个挪威研究，还有鹿特丹研究，他们是能够就是说证实这个健康人群补充了之后呢，是能够获益。对于今天我们谈到的这个慢性肾脏病的病人，他们能不能获益呢？ 未来需要更多的，我觉得需要更多大样本的随机对照的研究来证实他们的这个临床获益。这样的研究呢，我觉得它需要更长的这个观察时间，以及它所使用的维生素 K 的这个剂型我们来进行就是分层的这个分析，才能得出更科学的这个结果。下面
Next,
呢
I'll
再
be
给大家
talking
介
about the
绍一下
safety of
健康人
supplementation of
群补
vitamin
充维
K
生素 K
on
的这
healthy
个安全
individuals.
性啊。从
According to WHO
WHO
FAO,
他们的这个推
the
荐来
recommended
讲，
daily
就是
intake of
健
vitamin
康
K
人
for a
补充
healthy
维生
adult is
素
10
K 呢，
to 20
如
milligrams.
果说是
And about
每天
MK7,
10到
no
20
adverse
毫
events
克
were
啊
reported
10到
when a
20
daily
毫克
dose
是
of
比
6
较安全
microgram
的。
per
对
kilo
于
was given
MK7
to an
呢，
adult.
它是每公斤
In
体
other
重每
words,
天
it is safe for an adult of 60
6个微
kg
克
to take in
是
360
安全的。
microgram of
像一个
MK7
60
per
公
day.
斤重的成人的话，就是360微克都是安全的啊。到目前为止呢，是没有发现严重的毒副作用啊。补充维生素 K， 所以说健康人群补充维生素 K 是安全的。因为维生素
As
K 它
vitamin K
参
is
与了凝
related to
血
the
因子
activation
的
of
活
coagulation
化，
factors,
所以说
patients
不
and
光是
doctors often feel
患
uncertain
者，
about the
包
risk
括
of
也
blood
有医
coagulation
生，他也
upon
会
vitamin
提
K
出疑问。
supplementation.
健康人也好，就是说这个透析病人也好，我补充这个维生素 K 会不会影响他的凝血功能，带来这个它的这个促凝活性增加，会不会带来血栓的这个风险？对于此呢，
Regarding to this,
做
we
了研
performed the
究，就
research
是
to
说健
clarify
康
it.
人群补
We
充
found that that
MK7 之
consumption of
后呢，
MK7 by
它的
healthy
这个维
individual
生素
do
K
not
携带
increase
的
the
这些凝
activities
血
of
因子，就是
coagulation
2期
factors
90因子，
2,
它并
7,
没有
9,
活
and
性，并
10.
没有增
And
加。
even
我
after
们
1
是测
month,
了它的
no
活性，
increase
就
in
是
these
在
activities of these
测了就
coagulation
是补
factors
充了1个月之后，
correlated
它
to
的这个
MK7
凝血因子的
consumption
活性
was
其
seen.
实都没有增加的。那么
No
它的
prolongation
这
of
个就
measures of
是
blood
凝血的这
coagulation,
些初筛
including
检查
activated
PT、
partial
APT、
thromboplastin
GGT
time,
也是正常
prothrombin
没有
time,
延长。
and
那么
thrombotest
最重
was
要的呢，
observed.
我们还
In
就是
addition, no
检测了
increase in
这个
PIFCA2, the
非
precursor of
缩接
vitamin
化
K,
的
was
非缩
observed.
接化的这个
It is believed that the
这个凝
reason
血因子
is the
2因子的
additional
这个活性。
supplementation of
那么我
MK7 in
们
healthy
补充了
subjects
这个维
with
生
already
素 K
activated coagulation
MK7 之后
factors
呢，它的
cannot
这个未
promote
缩
further
接化的
carboxylation
因子的话，
or
它也
activation
没
of
有
the
增加。
coagulation
也就是说，
factors.
非缩接化的这个因子，我再给你额外的补充这个维生素 K 是没有办法再进一步提升它的这个缩接化的这个水平的。这也就解释了为什么就是说健康人群他补充了
In order
这
to
个外
understand
源
this
性的
result, we propose a
MK7 之后呢，
triad theory.
它的这个未缩接
This
化
is a
的这
theory that
些
reflects the intricate
凝
way
血因子，
in
它
which
没有
vitamin
办法
K
再
is
进一步
used
的
by
增
the
加
body.
啊。也就是在
Micronutrients such as
我
vitamin
们的
K are
生
first
理条
used
件
by the
下，在
body
我们的
for
生
its
理条
most
件下，这
important
些凝
physiological
血因子
functions.
它已经
For
100%
example,
的
blood
这个
coagulation,
缩接化了，
which
就
is a matter
是
of life
完
and
全的
death.
缩接化，你再补充也没有办法再
In the case of
进一步的
deficiency,
提升它的缩接化
vitamin
的
K
水
will
平。
firstly meet the
那么
needs of
从
proteins that
这样的
perform the
研究
most
结果呢，
important
可以
functions
用
in the
这个
body,
分流理论来
such
进
as
行解释。
blood
就是我
coagulation.
们人体啊，对
On the other
维
hand,
生这些
the
重
functions
要
of some
的
proteins that
维
are
生
most
素精
susceptible
妙
to
的利
chronic
用。
deficiency
那
are
么
compromised.
像这些
As
微
an
量的营养
example,
呢，首先满足人
insufficient
体最重
activation
要
of
的生理功能，
osteocalcin
像
and
雌
matrix
激
GLA
就是生
protein,
理重要的
MGP
功
can
能啊。
lead
因
to the
为
development
血
of
如果说凝血
osteoporosis
功能不好的
and
话，那么出血
consequently
病人人体
negative
会
effect
丧
on the
死。
body.
那么在维生素 K
And
缺
of
乏的时
course,
候呢，那
vascular
么维生素
calcification is
K
one of
它的
them
利用
too.
首先满足我们人体最
In
重
modern
要的功
diets,
能，它
adequate
比如
amounts
说
of
凝血
vitamin
因
K,
子，
which is
首
necessary
先
for the
保证凝血因
carboxylation
子
of
的这个缩
coagulation
接化，
factors, are
那么它就会
incorporated.
牺牲掉那些就是慢慢的
Extra
缺失
supplementation
才
will
会带
not
来
promote
影响
further
的
carboxylation of
影响生理
osteocalcium.
功能一些蛋白的功能，
However,
比
we
如
believe
说
that
骨钙素，
proteins
比
associated
如
with
说
chronic
MGP 蛋
diseases
白，
are
因
still
为骨钙
insufficiently
素的
carboxylated
这个功能
and
其
should
实
be
它会
further
带来骨质
supplemented.
疏松，骨质疏松它会慢慢的，它不会带来这个
Consequently,
即刻的这个
additional
对健康的影
supplementation
响。
could be
比如
linked
说
to the
血管钙
prevention
化，
and
它也
improvement
是
of
这
chronic
个
diseases
慢性的
such
这
as
个影响啊。
osteoporosis and
那么
vascular
现在的
calcification.
我们的饮食结构摄入的维生
To
素
make it
就
easier to
身体摄
understand,
入的维生素
firstly
是
half
能
a
够
tub
满
of
足维生
water.
素，满足
When water,
这
which
些凝
represents
血因
vitamin
子的缩
K,
接化的
is
需求
poured from
了
the top,
啊，摄入
the
的已
bottom,
经完
which
全能够
represents
把这些
coagulation
凝血因
factor,
子
is
足
filled
够
first.
缩接化了。那么我
So
们
in
再
order to
额外的
satisfy the
补
demand
充
for osteocalcium and MGP proteins high up, we'll have to fill it with more water. In other words, we believe that additional vitamin K supplementation plays an important role in the prevention of chronic disease.
骨钙素呀，还有 MGP 蛋白这些跟慢病相关的这些蛋白，它的羧基化 因为这在生理条件下，这些蛋白它羧基化是不完全的，所以说需要额外的补充来就是说来预防和控制这些慢病，比如这个骨质疏松或者血管钙化这些慢病比如说就像这样一个桶刚才讲的这个分流理论，如果说你凝血因子很少的时候，我的水只能加到这么多，然后首先就满足凝血因子，那么只有额外的补充更多的维生素 K 的时候呢，它的维生素 K 才会利用到这个骨钙素和肌质嘎纳蛋白。所以说对于我们人体来讲呢，需要额外的补充这个维生素 K 来满足这些其他的跟我们慢病相关的这些功能蛋白的这些活性，才能预防这些慢病的这发生。最后呢
Finally, I
做
would
一
like
个
to
总结
summarize
和展
today's
望。那
presentation
么
and
对于
discuss
严重
future
影响这个
prospects.
CKD
At
的
the
心血
moment,
管健康
there
的
is no
目前
effective
来说呢，
treatment for
这
vascular
个血
calcification,
管钙化呢
and
目
this has
前是没
serious
有
impact
有效的干
on the
预手段的
cardiovascular health
前
of
面已经
patients
提
with
到的，
chronic
无论
kidney
是
disease.
通过抑制血磷，
Vitamin
还
K2 has
是就说
shown
通
some
过
promise in the
降
prevention
低
and
这
treatment
个
of
这
vascular
个血脂，
calcification in
都是没
chronic
有
kidney
办法抑
disease,
制钙化。那
while
么
suppression of
从
phosphorus and
理论
lipids in
上
the
来
blood
讲，维生
has
素
not been
K2
shown to be
是
as effective.
有利于这个防治这
In
个慢性
addition, the
肾脏
safety
病
of
的这
vitamin
个心
K2
血管钙化
supplementation
的。
has
那
been
么从
confirmed
大量的
using
这个
human
实验
trial
数据
data
和真
and
实世界的
real-world
研究结果
evidence.
呢，是能够支持
Also, large
补充
studies
维
in
生素
Japanese and
K2，它
Norwegian
是具有良
populations
好的
have
安
shown that
全性的。
benefits of
那
vitamin
么普
K2
通人群呢，
supplementation
普
in the
通人群
prevention of
补
cardiovascular
充维生素
calcification,
K2 呢，它是
cardiovascular
有利
disease,
于
and
这个
osteoporosis.
心血管的钙化、
Vitamin
心
K
血管
taken
疾
in
病的
normal
发生
diet
以
meets
及
the
骨
minimum
质疏松的
requirement
预
to
防。
maintain blood clotting,
这些
but
研究
this
呢，
does
可以
not meet the
从这个鹿
physiological
特丹研
requirement
究、
for
挪
vitamin
威
K
研究
associated
和
with
日本
chronic
研究大
diseases.
样本的人群的研究可以得到
Furthermore,
支持。
due to the high incidence of
那么膳
calcification
食
in
补
patients with
充这
chronic
个
kidney
维生素
disease,
K，
we believe that
那么
large-scale intervention
能够
studies
满
should
足
be
我们生
conducted
理
to
的
assess the
生理的
preventive
凝血
effect
因子的
of
需
vitamin
要。
K
那么跟
on
慢病相
calcification in
关
the
的这
future.
些蛋白呢，那我们生理摄入的维生素 K 就不足了，就需要额外的补充。那么对于慢性肾脏病这样一类特殊的人群，他们的钙化发生率高，那么他们补充维生素 K 能不能预防他们的钙化会不会给他们带来更多的临床获益？需要做大样本的这个临床的干预研究来进一步的这个证实。好，今天就和大家分享我的做的
That is
这
it.
些工作。
Thank you very
谢
much
谢。
for your attention.